Thank you, everyone, for joining us at today's virtual patient symposium. I have with me Jeff Ellin. Jeff, why don't you briefly tell us about your kidney cancer diagnosis and experience?
So I found out I had kidney cancer in early 2023. Um, it was certainly a surprise, but it was also something that I knew I had a pretty good chance of getting at some point in my lifetime. A couple years earlier, I got diagnosed with something called BAP1 predisposition syndrome, and it is a gene mutation that basically inactivates one of your tumor suppression genes. I
Oh,
inherited it from my parents, or one of my parents. And when I found that out, I was told there's certain cancers that you're more likely to get, one of them being kidney cancer, the other ones being melanoma, uveal melanoma, which is eye cancer, and mesothelioma. So I was aware of this. I did some screenings and stuff over the years once I found that out, like for looking for melanoma and stuff, which I actually ended up having something removed in a year later,
oh,
2021, I guess. But then when I found out I had the kidney cancer, it was pretty obvious to me. It wasn't like somebody told me. I had some pain in my groin area and coincided with some lower back pain. So I went to the doctor. They thought it was kidney stones. I had like an ultrasound or like done on my kidneys to look for kidney stones, and immediately I got like my at John Hopkins they use like my chart.
yeah.
Immediately I got a message with a report, and it was like, hey, there's this mass suspicious on your kidney. And so like kind of at that point I was like alone in a car. Like it was like I knew what it was, like pretty much right off the bat. So that's how I found out. And um even though I knew about my chances of having it, being greater, it still was not the best feeling to find out and kind of alone in a car, not having a doctor, not having somebody to like ask questions about at that time. Those reports read pretty hard. At least I found out early on they did. I'm pretty good at reading them now, but
Yeah. So
you know,
what were some of your thoughts, like first thoughts when you saw this mass? Like when you told you have a mass and you kind of knew what it was, like
it,
what was that
it,
feeling?
I didn't have a plan. I didn't know how bad it was. I didn't know what level of extent it had spread. When I hear like adrenal glands, so I mean, the worst things start going through your mind, like I didn't want to tell my kids
Yeah.
yet. I didn't want to tell a lot of people until I actually knew more about it, and I've kind of always um like had a plan together, right? Like, and so um it was definitely hard, just not knowing stuff. So like like you would see your kid and be like, what if I'm not here in a year? Who's gonna cut the grass? My wife, she has rheumatoid arthritis, like early stage. Like, who's gonna open jars for her? How's she gonna carry? You know what I mean?
Yeah.
Like all those things kind of go through your mind, and it definitely numbs you. I had a work event in Chicago, um, in between the ultrasound and the CT scan. I'm like, well, I'm still gonna go. Like I
Yeah.
was like speaking and all this stuff there in front of like 120 people. I'm like, well, I'm still gonna go. But I wasn't myself. Like we had like events. I kind of just sat and moped around because like I didn't know anything. And the pain that I originally had, I was still having also. I'm like, why is this? If I have kidney cancer, why am I having pain in my testicle area? And I know why now. I've done a lot of research. I've learned. I've found out a lot medically in the last 2.5 years. So I can like connect all the dots now, but at the time, when you don't know anything, it's pretty scary.
Well, we're talking about information. So when you started looking up information, where did you turn to for support and
Yeah.
information for after
So,
diagnosis?
so my wife, and my brother, so they knew eventually. I didn't even tell like my mom. She was in Florida handling my dad. I didn't want to make things worse for her until I knew what was up. So those two closely, I reached out to a mentor of mine in my profession whose son has had quite a battle with cancer also to just get his perspective. An ex-manager of mine, unfortunately, has some pretty advanced form of colon cancer. I actually reached out and talked with him quite a bit. And I literally like pulled every card I could also with like knowing people who work at hospitals or leveraging friends of my brother who like runs a radiology center and was like, just come here so you don't have to wait 2 weeks to get it and you can just come up here and get it done tomorrow. You know what I mean? So I drove to New York, stuff like that. So um really like was like heads down, action oriented, and I had like my close family, but then support from others that also were helping. So
And you had mentioned earlier that after diagnosis, you went to a work event, you were speaking, you could tell you weren't yourself. Obvious that to me is just an obvious thing to happen to anyone who gets a diagnosis. But
yeah.
over the time, how have you found yourself changed? Like what changes did you notice after your diagnosis?
Yeah. Um, as things progressed, like I have become, I'm very open to talk about it. It's kind of therapeutic for me, to be honest with you. People sometimes hesitate to ask or not. I'm like, don't worry. You know what I mean? I'm okay to talk about it. One, just educating myself made me understand things more, and that sense of like not knowing, is like a very big thing for me to like me feel more confident about things or understanding what certain things mean. So I've done a lot of like self-education, and speaking with people and stuff that just honestly I just have a different outlook on it. Like it's
Mhm.
not the end of the world. I still do everything, that I did before. I get scanned quite often, at least every 3 months. Up until I just passed a milestone, so now it's every 4 months, which is a good thing. Um, I I get scanned actually more than you should know. I'm in so many studies or trials at the NIH, or I was in one and then had to get out for another medical reason and then get back in. So like I've had, you know, so many scans. I used to get PTSD, like
Mm.
literally like around scan time. Still get nervous. I don't like the feeling, but I don't know, I'm just more at calm or at ease with the whole situation. And again, I don't try to like, I don't know, I try to live like the same, like, and that just helps me cope, to be honest with you. And I live every day like it's, nothing's going on as much as possible outside of doctor's appointments and stuff.
And so, for people who are listening who may have the same type of gene mutation,
Yeah,
what advice would you give them to like kind of navigate this reality, right? Like, I could
yeah,
imagine it's hard knowing that, hey, I'm predisposed to cancer. Now it's just a matter of waiting for when those shoes will drop.
yeah,
What advice would you give them to kind of cope with it, if you will?
yeah, yeah. So there's coping. Honestly, like there's been recent studies put out. There's some specialists who focus on this gene, across different forms of cancer, and there's been research because it was pretty rare. It was discovered in 2011, and new also. So they're still learning a lot more about it, but there are programs, and I didn't realize this at first. This is the one mistake I made. Like, yes, I sat with a genetic counselor, and they said you should get dermatology screenings. I mean insurance wise, this was a while ago. I faked kidney stones one point just so I could have an ultrasound of my kidney. Like I was
Yeah.
like, um, and I get eye exams, imaging done like once a year. So like if you screen yourself, there are programs you can go to the NIH. There are studies, trials going right now. They pay for you to like travel there. You get CT scans at certain intervals, like every MRIs and stuff like that, to look for it. And if you find out you have it, like it's best to get into one of those programs so you can actually get the screening. You can help other people. That's part of the thing. Is like, yes, I am helping more people later on by being in these trials and stuff, but there is a benefit of A, if it works, or A, I have more eyeballs on me. Me getting to that trial is what actually made me discover I had mesothelioma. In the clinical trial that like the study for the BAC1 patients. So I signed up to have what's called a VATS surgery, is video assisted thoracic surgery, where they basically stuck cameras in me, to look in my lung cavities or whatever, to see it. And the images proved that I had, and they did a biopsy, and I had mesothelioma actually in both lung cavities as well as my stomach. peritoneum. So
How have your personal relationships changed after your diagnosis?
they, at this point, you know, I feel like they're kind of the same. At first, it was definitely like I felt like some like oh poor Jeff type. Like I don't want to say it that way, but but just like more caution around like especially early on when I didn't know a lot or it was still like waiting to see how things would progress. But I think over time it's like oh, you going to the doctor? Okay. You know what I mean? Like again, back to kind of normal. I mean, I think I take a different mindset in life, like moving forward. Like I'm going to enjoy a lot more stuff than maybe I would have not before, just in case something happens. Like I really, you know, at times I live by the mental state of like, okay, I'm good for another 3 months or 4 months. But I think actually I'm getting more like, no, I live for the next, you know, the rest of my life.
Yeah.
And so my personal relationships haven't at this point they're pretty much the same, I feel like.
No, but that's great, right? Like we
Yeah, yeah.
don't want cancer to be this thing that just like brings everything down around you. So
Yeah.
it's great that your relationships are the same and that you're like living for forever versus, just a
Yeah.
finite time.
I try to do everything I did before. I run this marathon, the Marine Corps Marathon. I've been running it every year since 2014 when a very good friend of mine was like, he was a Marine. He was killed in action. And I ran it the first year with my brother and one of his best friends, and from the Marines. And I've done it every year since. And I did it. I've done it the year I got my kidney removed. I was on the treatment that Belsudefen drug lowers your hemoglobin to like low nine, and I did it there. I didn't have a great time. I did it again last year. I'm signed up to do it again this year, although I do have surgery like 3 weeks beforehand, so it might be a little pain, but I'm gonna still do it.
I could imagine you'd be in a little bit of pain, but I get also
Yeah.
like even like pushing that aside to kind of like complete something and feel accomplished in this.
Yeah, it's a good mental thing. It really is. It's like I'm living a normal life.
Yeah.
And it is like to be able to like physically push myself to do that stuff, but also it's very mental, like a big mental hurdle for me. It's like it's not just like one race. It's like you have to train for it. So
Yeah.
get out of bed. You know what I mean? Like
Is there anything else that you would like to share before we end?
if you don't have kidney cancer, I do think this is like something good to know. Like how I had that te testicle pain that I mentioned, and the reason why I had that is because your vein from there drains into your left renal vein, and you know, luckily or unluckily, I mean, luckily, my kidney cancer was actually in my left kidney, and so basically, it created this pressure where the blood couldn't flow quite the same, and so like I would just say it's pretty good to like be in tune with your body. Meaning like if something just feels odd, it might not even feel like it's in the right spot, but you can, you know, things, you know, your body works certain ways, and if you don't know a lot about it, it touches a lot of things. So basically what I found out is I like, hey, it's, you know, if you're gonna have kidney cancer, it's good to have it in your, you know, your left kidney, at least from a male perspective, because it can help identify and spot it sooner rather than later.
Absolutely. Well, thank you so much for joining us, and thank you to everyone who is here at VPS. Stay tuned for more.